I recognize the honourable member for Halifax Citadel Sable Island.
Madam Speaker, on February 20th, every Nova Scotia child and adolescent psychiatrist sent a letter to 25 MLAs, including the Premier and the Minister for Addictions and Mental Health, expressing their concerns about the rollout of Bill 334. To date, they've received no response from government members. Now they're being told that the purpose of Bill 334 is completely changing. Instead of the minister's stated intention of providing additional access to people with mild to moderate needs, Bill 334 will focus more on the more complex, severe patients we see in the public mental health system, and I'll table that. The psychiatrists have said they're concerned about safety and systemic challenges related to the relative lack of integration, peer supervision, oversight, and access to psychiatry. Will the Minister of Addictions and Mental Health listen to the team of experts working for the well-being of child and adolescents?
I recognize the honourable member for Addictions and Mental Health.
Thank you, Madam Speaker, and I thank the member for this important question. The Health Services and Insurance Act is really enabling legislation for access to care for Nova Scotians. It's the first publicly funded addictions and mental health care legislation of the kind in the country. So we certainly take feedback from clinicians very seriously. I did sign off on correspondence to respond to that letter this morning, and we certainly will have continued dialogue with these clinicians. Thank you, Madam Speaker.
The honourable member for Halifax Citadel Sable Island.
There are also concerns about the pilot to decrease wait times for autism and ADHD assessments. Private psychologists working under the pilot are completing in-depth assessments and being paid $4,000 for each. Psychologists working in the public system are being told to limit the scope of their assessments from what would constitute best clinical practice and are only being paid $7.50 per assessment, and I'll table that. There is the fear that this disparity will lead to more public psychologists leaving to work privately. Recent data shows that there are 31 psychologist vacancies within NS Health. Psychiatrists are also agree, saying the damage to team morale and to our public mental health system workforce is already happening. How can the minister claim to take the concerns of the Nova Scotia's mental health professionals seriously if he didn't respond until maybe this morning?
I recognize the honourable Minister for Addictions and Mental Health.
Thank you, Madam Speaker. What I do know with this pilot specifically, that there's been over 50 families who receive diagnostic tests that wouldn't have otherwise, and access is our number one priority, and it always has been. Thank you, Madam Speaker.